could not detect a heartbeat or pulse, but he was obviously moribund and having considerable difficulty with his breathing. At this point, I elected to do a tracheostomy. To assist his breathing, requested assistance from Dr. Kemp Clark, Chief of Neurosurgery, Dr. Charles Baxter and Robert McClellan, attending surgeons, who came to my assistance immediately. Blood transfusions were began. With the assistance of Drs. Baxter and McClellan, I completed the tracheostomy and respiration was assisted. At the time of the tracheostomy, I noted evidence of air and blood in the upper mediastinum. I felt that an injury had been sustained in this area by the passage of the bullet through the neck and asked that a chest tube be put in place, which was done. Dr. Pepper Jenkins, Chief of Anesthesia, by this time was assisting his respiration. Dr. Selden and Bashir from the Department of Medicine were in attendance also. We noted that, again, there was no detectable heartbeat or pulse. I instituted cardiac massage, externally applied, and Dr. Kemp Clark and I continued this massage for a time that is unknown to me. I was quite busy at this particular instant. I don't know the exact time sequence. An electrocardiograph was attached to Mr. Kennedy to monitor his heartbeat, but no detectable activity was present, and it was realized that the present had expired.
At Parkland, Dr. Malcolm Perry, attending surgeon, tried desperately to keep the president alive, but the very urgency of that problem prevented him from examining the two wounds, as he now explains in his first public statement since the report was published.
I noted a wound when I came into the room, which was of the right posterior portion of the head. Of course, I did not examine it. Again, there was no time for cursory examinations, and if a patent airway could not be secured and the bleeding could not be controlled, it really made very little difference. Some things must take precedence and priority, and in this instance, the airway and the bleeding must be controlled initially.
What about this wound that you observed in the front of the president's neck? Would you tell me about that?
Yes, of course, it was a very cursory examination. The emergency proceedings at hand necessitated immediate action. There was not time to do more than an extremely light examination.
There's been a lot said and written about was this an exit wound or an entry wound? Would you discuss that with me, sir?
This is a difficult problem. The determination of entrance or exit frequently requires the assertion of trajectory. And of course, this I did not do. None of us did at the time. There was no time for such things. The differentiation between an entrance and exit wound is often made on a disparity in sizes, the exit wound generally being larger in the case of an expanding bullet. If, however, the bullet does not expand, if it is a full-jacketed bullet, for example, such as used commonly in the military, the caliber of the bullet on entrance and exit will frequently be the same. And without deformation of the bullet and without tumbling, the wounds will be very similar, and in many instances, even the trained observer could not distinguish between the two.
Did it occur to you at the time, or did you think, was this an entry wound or was this an exit wound?
Actually, I didn't really give it much thought, and I realized that perhaps it would have been better had I have done so. But I actually applied my energies, and those of us there all did, to the problem at hand, and I didn't really concern myself too much with how it happened or why. And for that reason, of course, I didn't think about cutting through the wound, which, of course, rendered it inviolate for as regards further examination and inspection. But it didn't even occur to me. I did what was expedient and what was necessary, and I didn't think much about it.
You did not turn the president over?
No, there was no reason to. There was not time at that problem, and there was really no reason to. It made very little difference to me, since my immediate concern was with an attempted resuscitation.
The nature of the throat wound can no longer be verified, for no records were made and no pictures taken before Dr. Perry cut through it in an attempt to relieve his patient's breathing. The doctors at Parkland were engaged in a desperate struggle to keep the president alive. All else was secondary. But their task was impossible. One of the shots had virtually destroyed the president's head. Even as the doctors worked, the president died. At the hospital, the scene was turbulent and disordered. The press and public were clamoring for news. Dr. Perry was rushed from the emergency room to a news conference where he was badgered into giving a description of the wounds. The neck wound, he told the press, looked like an entry wound, and he pointed to the front of his neck. In the transcript of that news conference, there's no doubt that Dr. Perry made it sound as if he had a firm opinion. Well, the reporters flashed the news, and in that moment of confusion and misunderstanding established once and for all in the minds of a great many people a conviction that at least one bullet had been fired from the front of the motorcade.